Hi everybody, we're just going to wait a few more minutes before we make a start, just to allow people time to join, but welcome. It's great to see so many of you as part of this pre-launch webinar, and I'm so excited to have you all here with me today. It's great to see everyone typing their introductions into the chats. We'll just wait just a minute or so before we make a start, just to allow people to join. Just reading the people in the chats. I'm so excited to have so many people from all over the world joining this webinar today. So I think we'll make a start. So welcome everybody, and welcome to our pre-launch webinar on our research theme. I'm delighted to be working in partnership with the Nursing Now Challenge Global Solutions Initiative and bringing together a partnership between Nursing Now and the Royal College of Nursing on this really important theme of research. So today's pre-launch webinar is titled Nurses and Midwives as Change Agents. And I really want to encourage you all to think about the changes that you want to make as part of the research process. So thinking about the possibilities, potential and opportunities that research can bring. And I really want to thank Hannah as part of this as well, who's in the background, but who's done an enormous, phenomenal amount of work in working with me together to bring this series to life. So in terms of what we'll cover today, this webinar will be essentially in 3 parts. So bringing together why we should research, why now, and what next. So please do type in any questions that you have. Please do introduce yourself in the chats as well. And just a little bit about myself by way of introduction. So I realised that in terms of research, we often talk about the ideas around positionality and the need for openness and transparency about our interests and any potential biases that we might have. So this is partly to own up to my own background and where I've been with my research career, but also as part of an introduction to myself and my work as well. So the first thing to say is that I've had a particularly unconventional career in many ways. I'm a mental health nurse, but my first role was actually as a research associate. And I think that was where my real passion from research really came from, both in terms of being a student and writing my dissertation, which was all around service user involvement, what it means to genuinely involve patients and the public in the work that we do within healthcare. But also really bringing that to life in terms of thinking about my role as a staff nurse in mental health, which was working with people with severe mental illnesses and mental health problems, challenges, often with complex needs. So people often with a combination of mental health problems as well as learning disabilities was my role as a staff nurse. And so that really challenged me to think quite differently about what it means to work within rehabilitation settings within mental health and what the term rehabilitation really means, whether it's really for the benefit of the patient or society, sometimes both, or perhaps sometimes also neither. My career then developed into being a practitioner health lecturer, which is essentially the equivalent of a modern day clinical academic. So I spent my week working 2 days a week in clinical practice, 2 days a week in research, and 1 day a week teaching. And that was an absolute dream job where I learned so much and had the best of all worlds in doing all the things that I absolutely loved. And it was through that that I really started thinking about, what does it mean to build a research career? And I was really fortunate to have mentors at the time who really encouraged me to think about applying for a PhD. And my PhD was in sociology and social policy. And I decided to challenge myself to do my PhD in a different discipline, partly because I was really inspired by the work of David Pilgrim, who talks about the interdisciplinary void. And he talks about the interdisciplinary void, particularly in the sense of how we often create artificial divides, artificial divisions between different disciplines, and how there's actually a lot that we can learn between health as well as sociology by combining those two disciplines together. So even though my PhD was in sociology and social policy, it still had a very health related focus. My PhD was looking at the paradox of restrictive practices within high secure hospitals. So restrictive practices being the use of restraint, seclusion, segregation, and other forms of mechanical restraints as well that might be used. And this was at a time when there was increasing legislation on the one hand about what least restrictive practices mean, but also on the other hand, there was an increase in patient deaths due to the use of restraint as well. So I really wanted to examine, well, what does this mean? What are the potential conflicts and challenges here? And one of the completely unexpected things that I did as part of my PhD was just after I completed my PhD, I was invited to the House of Lords, which in the UK is all around changing policy, legislation, and practice. And I was invited to the House of Lords to talk about my findings of my PhD, to lobby and implement Cheney's law, which in the UK is around mental health use of force, which is to better protect patients in mental health settings over the inappropriate use of force. And this came into law in 2021. And it's referred to as Cheney's law because Cheney unfortunately died as a result of inappropriate use of force and restraint. So I think for me, that was where I really came to thinking about the power of research in terms of having the potential to save lives. And that for me was my first kind of real thinking about, gosh, we can do so much within the research space, not only to protect patients and the public, but also to do things better and differently. So this was followed by a number of years working in academia, both as an educator as well as leading various research programs, and most recently as the deputy director of postgraduate research, where I was supporting postgraduate students into research careers, and that's still something that I love and do a lot of as part of my current role as the UK head of research at the Royal College of Nursing. And I'll talk about that role more over my next few slides. So, in terms of why research, for me, research is for anyone who has a real thirst for knowledge and a hunger for change. So it's really about asking those curious questions, thinking about what do we know about things, why is it important, and how do we find out more? So as nurses and midwives and healthcare professionals, we often think about evidence-based practice. And it's great when we think about how we use evidence to change our practice and to deliver practice more effectively. But evidence is essentially the end point of research. So in order to know what good evidence is, it requires us all to have that knowledge about the research process right from the very beginning. And it requires us to include people from all sorts of different backgrounds and different professions as well, to really think about, well, who is asking these questions? Who has the opportunity to really be involved and to have their voices heard? And then to think about, well, what makes a good research question? What makes a good research study? And how do we make it high quality so that it's really impactful and influential? So all research essentially begins with a question. The next step then is to think about, well, what are you going to do about it? So that curiosity breeds knowledge. It helps us formulate ideas, questions, deeper thinking about certain topics, populations, and developing those ideas and potentially theories as well. And it's that action, so the actual doing of research and enacting the findings that brings about change. So what I really want to encourage you to think about is, well, what are you curious about? And that could be related to certain topics, certain questions, certain populations, or even the context in which you work. I'd also like to encourage you to think about what is it that you want to change? So this could be around education, society, patients, public. It could be also around policy, legislation, or even how research is conducted. And in terms of thinking about how you might go about doing this, so thinking about what are the research methods that people use? What research methods are you personally drawn to? So you might, for example, be more drawn to the idea of, I want to learn about people's experiences, which would be more closely aligned with qualitative research. So thinking about what are people's narratives? What are they telling us? What are they saying? And what are they not saying? All of those are really important questions to ask. You might also be wanting to think about, well, is it individual voices that I want to hear about? Or do I want to hear about people's group discussions? So thinking about group interviews, focus groups, for example. You might also want to think about, actually, I want to think about how we generalize our research findings. So thinking more about the quantitative side, which is about numbers, larger scale studies, thinking about what we know already and what we need to change. Or you might even think about mixed methods, which might be a combination of the use of qualitative as well as quantitative methods, or using multiple methods, which would be a combination of either qualitative and qualitative methods, or quantitative and quantitative methods. So there's a whole variety of different ideas and ways of doing research that we can use to uncover these questions and to explain why we might be finding these things in more detail. I'd also really encourage you to think about your own career goals and ambitions. So what are your aspirations? What do you want to do? Where do you want to be in your career? What are the potential opportunities and what do you need to realise what do you need to do to realise these ambitions? In other words, really encouraging to think about, what are the next steps and how do we get there? And what can we do as part of that process to support you? And these are all things that we'll be exploring in further detail throughout our research webinar series. So moving on to the second part of the presentation today, why are we doing research now? And why are we thinking about research in this current space and time? We're recognising increasingly that there are inequities in research opportunities, both between different healthcare professions as well as within healthcare professions as well. So when we look at, for example, the funding and how research funding is spread across different health professions, traditionally, nursing and midwifery tend to be more underfunded in comparison with other health professions. And so one of the reasons for thinking about research, particularly for nurses and midwives, is thinking about how we can change this landscape. How do we change the perceptions of nurses and midwives as actually also being researchers and being experts within their fields within this space? There are also inequities within the professions. So it's actually really rare that any form of inequity, inequality occurs in a single form alone. So this might be around people's protected characteristics such as gender, ethnicity, beliefs, disability, all of those different aspects. And it could also create further inequities, for example, within education, employment, career opportunities, accommodation, all of those wider social health connected challenges. And within nursing specifically, there are inequities, for example, between the different fields of nursing. So within the UK, we have 4 different fields of nursing that are recognised. We have adult, children's, mental health, and learning disabilities. And it's often our most vulnerable populations. So our vulnerable populations being mental health and learning disability that often get missed or underfunded. It's also about thinking about the future of our nursing profession. So we recognise that there is a global shortage currently of nurses. But thinking about actually our profession is so absolutely diverse in terms of what we can do. So thinking about what can we really do to really create greater passions for the profession and to encourage the public to think about us in different ways. So thinking about how we role model the different things that we do, how we showcase different things that we do, and how we really create the idea of nurses and midwives as experts. And there's also now currently a real drive towards aligning research, so embedding research within the nursing professions, both nationally as well as globally, and thinking about how we really drive research, not only within education, but also in practice and in terms of career development later on as well. So seeing nurses as researchers rather than nurses as either nurses or researchers, and the same with midwives as well. So some of the things that we've been doing at the Royal College of Nursing. So in my role as the head of research at the Royal College, one of my tasks has been to lead our national research strategy. And this in itself is around maximising impact and outcomes through doing and being involved in research in different ways. And this essentially was a piece of research in action in its own right. So we went through a whole series of stages with this piece of with this strategy before it went live. So we started off with a review of the literature, of policies and strategies. So looking at what does the literature say within the field regarding research. What does this mean, particularly for nurses, midwives, nursing support workers, nursing associates and students? And because the Royal College of Nursing is a professional body as well as a trade union with over 500,000 members, we ran a series of focus groups, online feedback, to really gather the thoughts of our members, think about, well, what do our members say and how does this compare with what the literature says? Are there gaps between these 2 different areas? And what might be the commonalities within all of this as well? We also had expert advisory groups, and these were experts from all fields of nursing and midwifery, and also from all different backgrounds and different contexts as well. So it included people who worked in really senior positions, as well as all the different roles in between, including students, people who are early career, people working in academia, people working in clinical practice, to really get all of those views across. And we also work closely with our forums and fellows as well to think about what does this mean in different spaces? What do these different perspectives offer? And we went through a real iterative process, going backwards and forwards between what the literature, policies, strategies say, with what our members said, and what also our non-members said as well, in terms of what's important within this research space, and how can we really build this research space for the future of our professional body, as well as our professional groups. And we did this through a series of thematic analysis. So looking at what are the common themes throughout all of these things, but also what are the things that really stand out as being different, and how do we bring this all together as one single document to really celebrate what we're doing currently and what the potential is in terms of making research fit for the future for our profession and also for the patients and public as well. And essentially this led on to 3 core themes which form as part of this research strategy. First of which is influence. So thinking about how we support culture of curiosity. How do we really enable access, engagement, inclusion, delivery, as well as leadership of high quality research across the nursing professions? The second theme was around infrastructure, and this was twofold. So this was looking inwardly at our organisation and thinking about, well, what are the gaps within our current infrastructures? How do we really build our organisational profile so that we can support our members in better ways? And the second part was also looking at infrastructures outwardly. So thinking about what are the current challenges, barriers and enablers within systems that either enable or constrict our ways of working within research. So thinking about what infrastructures need to change, what systems need to change in order for us to do research and to do research better. And the third theme, which was around impact. So having a really strong, high quality evidence based to think about how we really can distill research within practice and how we can really share and mobilize knowledge to really make a difference within our practice, legislation, education, and all different aspects of creating that change. So we published our research strategy in September last year, and we launched it at our research conference. And we've already started making some differences within the work that we do. So I'll be sharing these slides with you after this webinar, but all of these titles that are underlined are essentially web links. So if you click on those, they'll send you directly to the things that I'm talking about. So you'll have access to a range of resources as part of this webinar today. So we've updated all of our RCN nursing research web pages to really think about, what is helpful, what is important to people, what is the information that we really want to give. So on our nursing research web pages, you will find information on our research strategy, various resources, access to our forums, as well as various events. So this, for example, includes access to our library resources. And our library offers so much rich access to different resources in terms of, books, access to journals and journal articles, but also more importantly, the library offers training around how to conduct literature reviews, how to reference, how to write essays, how to write assignments, and how to write for publication. And we've also been working hard to focus on how we deliver evidence-based workshops as well. So thinking about how we use evidence in different ways to really mobilise that knowledge and create changes in what we do. We have our link to our research forum. So thinking about how we might get involved and how we might get members involved in doing research in different ways. And we also received funding from the NIHR, so England's largest funding body, funded us to develop a series of these 6 research modules, which we partnered with King's College London to design and deliver, along with other expert advisory groups as well. So these 6 modules were all focused on research at different aspects of the research process and how people might get involved in different ways. So module 1 is all about getting involved in clinical research, so learning the fundamentals of how you might get involved as a starting point. Module 2 is around demystifying approaches to quality improvement and service delivery. Module 3 is around answering clinical questions from a range of different perspectives. Module 4 is around a research methods toolkit, so thinking about how you might approach different questions that you have about the world and how you might design a research study. Module 5 is around evaluating complex interventions and clinical trials. So thinking about, after you've delivered a piece of research, how do you know whether that evidence is effective or not? So thinking about how you evaluate things and improve the research study so it's better for next time. And module 6 is around good governance and ethical considerations in clinical practice. So we often think about ethics as being important within research, not only from a standpoint of getting ethical approval so that you can conduct the research study, but also ethics in the sense of making sure that your research is delivered in ethical ways throughout that study process. So these modules can be accessed across the globe. They are absolutely free to access, both to RCN members as well as non-members. So do have a look at these research modules wherever you are in the world. They are free. All you need to do is sign up to an NIHR Learn account, and I'll include details these details are all in the link here so you can access them. And you can dip in and out of these modules as well. So you don't have to complete module 1 before moving on to module 2. You can dip in and out depending on what your interests are, what's most valuable and applicable to you at the time. And all of the modules are interactive as well. So they all include information on keeping your own personal journal, for example, to document what you've learnt, areas that you want to look into in more detail. They include a variety of resources, including, where to find information, their short videos, all sorts of different quizzes as well. So they are very interactive in that sense. So please do go away and have a look at those. We also have our annual public lecture. So this year it's on the 19th of March between 5 and 6:30 GMT, so British time. And the theme of our annual public lecture this year is all around health justice. And I'm highlighting this because we host this public lecture every year for our public as well as healthcare professionals to all come together within this space to have these really deep, in-depth discussions around topical issues and concepts. And again, this is completely free. You just need to book a place so that you can be sent details to attend, because it will be hybrid. So people who are based or work in London can attend in person in our headquarters in London. But for those of you working across the world, you can also join online. So I hope to welcome many of you there as well. We have just launched a postdoctoral bridging fellowship award. So this is in partnership with the RCN Foundation, which is the charity arm of the RCN. And this is to support a postdoctoral research fellow, so to support people early in their research careers, to focus specifically on racial inequities in access to doctoral education. And this is the first year that we have launched this programme. The advert for the research fellow is currently live. So if you are in that position of being a postdoctoral researcher within 3 years of completing your PhD, please do reach out if you're interested or apply online for this position. I think it's a really great opportunity, especially because we're partnering with both our charity arm, our professional body, as well as our academic partners as well within the space to really support people to grow their experiences and profile within research. We also are growing our global community of practice via our research hub. So this isn't live just yet. We are preparing this to go live shortly. So please do use this QR code or the link to sign up your interest in this space, and you'll be sent further details when we are ready to go live. So we're trying to build this community of practice where it's going to be community-led. So the idea being that people with an interest in research will be able to ask questions, for example, to say, I'm looking for a mentor in this space. Is anybody interested? Or it can be, I'm looking for a PhD supervisor. Does anybody work in this area or know of anybody that I can talk to? Or I'm building my research partnerships, collaborations. I want a research placement to really learn what research is like in practice. So really asking those questions and really building that community and that interaction between different people across the world to really support people in this research space. And also our RCN International Nursing Research Conference. So our call for abstracts are currently live until the 9th of March. So please do consider submitting an abstract to present at this conference. The theme this year is Research Without Boundaries: Innovation, Collaboration and Global Impact. So we're really trying to reach this global audience and to really grow this space for people working around the world within research, and to really have that opportunity to showcase what you're doing within this space as well. And these abstracts can be for an individual poster, oral presentations, symposia, or even flash talks as well. So flash talks being Petra type presentations where you have just a short amount of time to really present your research and give that snapshot. And we're also going to be subsidising some places for this conference. So we'll be subsidising 5 places for people to attend this conference from disadvantaged backgrounds. But this will also essentially be the prize for our research webinar series as well, which I'll talk about in a bit more detail over my next slides. So do save these dates. The conference will be between the 15th to 17th of September in Glasgow. So do save the dates to make sure that you're free. So you're in with a chance of winning our prize draw. So what next? So as part of our theme, as part of our research theme for our Nursing Now Challenge Global Solutions Initiative in partnership with the Royal College of Nursing, we'll be delivering a series of webinars throughout the next few months. So this is our pre-launch webinar, but our official launch date will be the 27th of March. And our launch session will be focused on the power of research, where we have a series of guest speakers from across the world who'll be talking about how they got into research, what their career pathways were, what they're doing now to really make a difference and make a change within what they do and the areas that they work. So I hope many of you will be able to join us on the 27th of March for the first session. Our second session will be on myth-busting monsters. And this is around owning what you know and learning the things that you don't know yet. So this session will really give an overview of different types of research methods, different research designs, learning both your comfort as well as discomfort zones, and really supporting you to build your confidence within this research space. So it's an opportunity for you to ask any questions that you want to ask within a safe environment. And there's no, daft question. Ask any question that you want. So come prepared. Write down all the questions that you've always wanted to ask but might not have had opportunity to do so. Our third session is titled Riding the Research Roller Coaster. So this session will explore our emotions relating to being a researcher, particularly when we're researching sensitive topics or where we might be working within challenging spaces and working with vulnerable people. So thinking about ethics, the participants that we work with, particularly vulnerable participants, and thinking about how we genuinely create that inclusive space for people to really be involved in research. And also thinking about yourself and your personal well-being whilst doing research as well. So this is really thinking about, the wider implications of doing research and the wider considerations that we might think about when leading research studies. And our fourth session is titled Leading Your Legacy. So this is focused around what do you want to change? What do you need to think about those changes? And how can we get there? So how can we support you within that process? And this session will also include a workshop around how you write a research proposal. So how do you write a good research proposal, and how we prepare you all for potential submissions as part of our prize draw. So as part of the work that we're doing, we'll be encouraging to, so at the end of these webinars, we'll be encouraging to submit a research proposal. And the research proposal will essentially be thinking about, well, what topic do you want to focus on? What are the core issues? Why is this important to you? What does this mean within the space that you're working in? So think about what do we know already, and how do we develop these ideas to create changes for the future? We'll also be asking you to include information about your research design. So what methods are you going to use? Who are you going to include as part of your research study? And what are your plans for disseminating this? So how are you going to make sure that people know about your work? And think about how people also might access the findings of your research study as well. And that's recognising that we often create spaces for publishing, but thinking about where you might publish your work as well, and how you might be supported in publishing your thoughts and ideas, whether that's a blog, whether that's an academic paper, whether that's creating something that's more creative and unique around that space to make sure that people have access to that information. And as I mentioned, the prize winner for the best submission will be invited not only to attend our RCN International Nursing Research Conference, but to have the opportunity to present your research proposal, to present your thoughts and ideas and experiences on what it's been like for you to be part of the Nursing Now Research Theme Challenge. So do please keep that date free if you're interested, not only in attending the conference, but also in submitting your research proposal, because that's all part of this series of webinars that we're launching. So I'm going to leave you with this final thought. So I realised that I presented this slide earlier on, but I want you to really focus on you to think about, what are you curious about? What do you really want to change? How might you go about doing this? So what is your thirst for knowledge? What is your hunger for change? What do you really want to do? And that will really stand you in good stead if you want to make some notes now in preparation for our launch, where we'll be delving into all of these ideas in more depth and detail. So thank you so much for joining us for our pre-launch webinar today. We've got some time for reflections, questions, and questions as well. So I've got my contact details here. Please do feel free to connect or reach out. I'm more than happy to support all of you within this space. So over to some reflections and questions if there are any. I'll just look through the chats as we're working through. So I'm just looking through the chats for the questions. So bear with me a moment while I read through. Thank you for the comments as well. So these modules are available across the world. So there'll be the NIHR research modules are available. So all you need to do is click on the link, and bear with me a moment while I stop sharing my slides, and I can put the link in the chats for you. And I'll share my slides with you at the end as well. But if I put the link in the chats, then you'll have access to them here. And as I mentioned, all you need to do is sign up for an NIHR Learn account, and you'll be able to access all of these modules free wherever you are and in your own time. I'm just looking at further questions and comments now. So somebody asked whether post-registration also includes post-PhD completion. So post-registration for me would be anyone who's completed their nursing or midwifery degree. Post-PhD would be after somebody has completed their doctorate, and that doctorate might be in any subject, and it could even include a clinical doctorate, for example, or doctorate in publication. But I think this relates to the research fellow role. So for anybody who's interested in the research fellow, you would have to be within 3 years of completing a PhD, because that is one of our requirements for our funding agreement for the grant. So newly qualified nurses are absolutely able to join the Nursing Now Challenge research theme. So the research theme and all, I believe, the Nursing Now challenges are designed and aimed particularly towards early career and student nurses and midwives. And a question around how people might launch their research career after their PhD. And that is a really great question. I think this very much depends on what do you want to do, what are you interested in, because there's so many ideas and potential. So for people who have already completed their PhD or are thinking about their PhD and thinking about, well, what do you do? What are the possibilities after a PhD? You might want to think about, well, if you're at that stage of thinking about doing a PhD, what do you want to do your PhD in? So that's not only the topic of your PhD, but also thinking about the discipline in which your PhD is going to be in, because that will essentially shape your ideas, your thinking, and your career trajectory. So for anybody who's thinking about doing a PhD in the current time, I always say to people, well, think about what you want to do after your PhD as well, because that's just as important as doing a PhD itself. But in terms of after your PhD, you'll be thinking about leading research and being a research leader. So thinking about how might you develop your ideas? What have you found from your PhD? And what are the next steps? So what are the gaps in knowledge after your PhD and where do you go from that? You might be thinking about, for example, applying for grant funding. You might be thinking about developing your career within the research space. So looking at opportunities to be a research fellow, for example, and working with other people on developing research ideas or building those networks and collaborations. So thinking about, well, who are the other leading people within this space? How do I connect with them? Send them an email. People are always happy to talk about their areas of research and passion and interests. So don't be shy about coming forwards. So send people those emails, connect with people on LinkedIn, for example, and just send them a message, say, I'm really interested in this. How can I get involved? What can I do to help? What can I do to support? And 9 times out of 10, people will always be willing to listen and to offer that support. So seeing a question here around, so someone says, I'm a newly qualified nurse and very interested in research, health and innovation. I don't know where to start and I need a mentor. So please do reach out to me after this session. I'm very happy to have a conversation around this. But in its broader sense, thinking about what do you want to do? So who could be a possible mentor in this space? And that very much depends on where you see your research career going. And you can have multiple mentors, especially if you're really uncertain about where you want your career to go. So, having a clinical mentor, for example, an academic mentor, somebody working within unusual spaces within research. You might also think about applying for research internships. There's a lot of funding at the moment that's supporting people to have internships, which include a combination of placements as well as working with research teams to really know what it's like to work within the research space. And that can be around research delivery. So, thinking about how we support research happening within practice. But it can also be around really innovative research and being right at the forefront of you being part of that data collection and analysis as well. So, thinking about what space are you interested in? Are there any particular topics that you're interested in? And thinking about focusing on those potential subject areas in particular. And also thinking about, well, what is your expertise? What expertise do you bring? Because we all have knowledge and insights in different spaces. So thinking about what you offer within that space as well. Just scrolling down to see if there's any more questions I might miss. Okay, so someone's asking if this opportunity is open to international participants. Yes, it absolutely is. I would love to hear from participants who want to be part of this research theme. So if you're interested, please do be part of the webinars that we've got.
Ada, I'm so sorry. We can't hear you all of a sudden. I don't know if it's just me.
Sorry about that. I'm not quite sure what's happened. It doesn't look like I'm muted.
I can hear you've just gone really quiet.
Oh, can you hear me better now?
Slightly. I don't know if it's any. It might just be me.
Okay, sorry
Oh,
about that.
that's it. That's better. Yeah, you're
Oh,
back.
is that okay?
Yeah.
Sorry about that. I'm not quite sure what happened there. But yeah, somebody asked if this opportunity is open to international participants. Yes, it absolutely is. So please do be part of the webinar series. You'd be more than welcome, and I'd be delighted to have as many people on board with research as we possibly can within this space. scrolling down. And thank you for the really kind comments about the session as well. Someone's asked a question about whether they can submit a research proposal which has already been published and conducted in another country. So I'd say no to that. I would much prefer people. So the idea of a research proposal is around submitting ideas for research that hasn't yet been conducted. So I'd be really keen to think about, what research areas are people really interested in, and how can you take that forward as part of the plan for your research proposal rather than something that's already been done. So if you've already published and conducted research, that's absolutely fine. And that's great to hear that you're already at that stage. But think about, instead of what you've already done, think about, well, how can that research be developed in further ways, and build a research proposal based on the next steps of developing that research further. And I think that would be the best way forwards for writing your research proposal, particularly within the context of this theme. There's a question about supporting early career nurses. However, such an initiative is also needed for those past in career stages. Is there a similar initiative for older people who want to become involved in research or to conduct research but need support or training? So I'd say that everybody is welcome within this webinar space. And I completely recognise that somebody could be an absolute expert within their clinical field and have years upon years of clinical practice experience, yet be in their early career stages of research. So you'd be absolutely welcome to join all of these webinars and to be involved in this space as well. So I'm still scrolling down because there's so many comments and thoughts in the chats, which is lovely to see. Towards the end of all the questions now. So thank you so much, everybody, for joining this session. I hope my mic has been working right through to the end. I'm sorry for any glitches in the tech throughout this session, and for missing the comments around my the mic not working clearly and properly, because I was so focused on delivering the session and I couldn't see the chats at the time. But thank you so much all again for all of your interactions and participating in the session. I very much look forward to seeing you all as part of the launch on the 27th of March. And our future webinars, and hopefully some of our sessions that we're delivering as part of the RCN as well, such as our annual public lecture as well as our research conference. So thank you all so very much, and I very much look forward to being connected with you all and to seeing you all again very soon. Thank you. Bye for now.